So this is the second video from our series focusing on the GPhC registration assessment. So I introduced you to the GPhC registration assessment in the first video, and I gave you an idea of the fact that it's a two-part assessment. So now let's look at the high, medium, and low weighting therapeutic areas when it comes to the assessment framework. So this tells you which therapeutic areas are more important than others and which therapeutic areas are more likely to be covered within the assessment. So your high weighting therapeutic areas, there are 4 in total, and I'm going to go through those in later slides. They cover 60 to 70% of the questions that come up in the registration assessment. And bearing in mind, one part of the assessment is solely calculation questions. So when I talk about therapeutic areas, I'm solely talking about the part 2 paper, which focuses on 120 questions. So 60 to 70% of the questions are made up of high weighting questions. And then you've got medium weighting questions. So these make up 25 to 35% of questions. Finally, you've got your low weighting questions, and these make up to 10% of the questions. So remember, it's up to 10% of the questions. So it doesn't even have to be 10% of the questions. This is important because this should give you an indication of how you should prioritize your time when it comes to preparing for the assessment. I know plenty of people that spend the first 3 months just focusing on low weighting material. Well, the problem that you have with that is most of the information you're going to learn in the first 3 months, you're going to lose. And you're naturally going to lose that from your long-term memory. And this is just the way our brains work. So there was some great studies done by Herman Ebbinghaus where he speaks about the forgetting curve, that 90% of newly acquired information is lost after a week. And it still holds true to this day. So that theory is still used when we talk about evidence-based studying to this day. So what I'm trying to say here is, if you're focusing on low weighting material, 3 months of your time, and it's going to make up to 10% of the questions, and you're going to forget 90% of that newly acquired information, it's not a good use of your time. So make sure that you're using your time proportionate to the weightings when it comes to the assessment. So let's consider the high rating therapeutic and high weighting therapeutic areas. So you've got the cardiovascular system, you've got the nervous system, so the central nervous system, the endocrine system, and infection. When it comes to each question, the GPhC are very specific to say that questions may relate to more than one topic area. And what they're trying to say here is, when you see a patient's not going to say to you, I only have diabetes. It may be the case, but in many cases, when you're managing patients, particularly when you're managing elderly patients, they come with several conditions. They have several comorbidities. And as a result of that, you have to manage several conditions. The condition in question may be the endocrine system. It may be the diabetes that's the problem for them. But they may have heart failure as well. They may have angina. So they may come with other conditions as well. So there's no promise that each question will include a patient that only has one condition. Then your medium rating therapeutic areas are the genitourinary tract system, the gastrointestinal system, the respiratory system, immune system and malignant disease, and blood and nutrition. So what did we say about the medium weighting therapeutic areas? We said they make up 25 to 35% of the questions. So this is still significant. This is a significant proportion of the questions. But your priority is your high weighting areas and then your medium weighting areas. And your low weighting areas, the musculoskeletal system, eye, ear, nose and oropharynx, skin, vaccines and anesthesia. From this, I'd say the largest therapeutic area that you need to learn is the musculoskeletal system. It's quite a chunky therapeutic area. Only recently in the past few years has it moved down to a low rating therapeutic area. But the rest of these are not huge topics per se. We still cover those very well within the MicroPharm modules. So the Pro and Pro Plus modules. We even cover it in the Essential plan as well. But these make up to 10% of the assessment. So again, take that on board. Do not spend most of your time or even a third of your time on the low rating therapeutic areas if you don't know the high rating therapeutic areas well. So these are your high risk drugs. Each assessment is likely to include at least one question on each of the therapeutic areas that they mentioned. So the following drugs or drug groups. So these high risk drugs are very important. You will have at least one question. You could have 10 questions on just antibiotics. There's nothing to stop the GPhC from doing so. There could be 5 questions on antibiotics, but at least one will be covering antibiotics, anticoagulants, antihypertensives, chemotherapy, insulins, anti-diabetic drugs. This would particularly include those that are used for the treatment of type 2 diabetes mellitus, parenteral drugs, drugs with a narrow therapeutic index, including antibiotics. So which antibiotics have a narrow therapeutic index? Some that I can name off the top of my head: gentamicin, vancomycin, NSAIDs, methotrexate, opiates, and valproate. So this is what we're going to cover in today's video. And in the next video, we'll start to talk about common mistakes that people have made in the previous GPhC assessments as highlighted by the GPhC. There's a lot to learn with that video because these common mistakes tend to happen every year, which gives you an indication that they tend to come up every year. So it's very good to know about these common mistakes.